It's no secret that our right to vote is the foundation of our American democracy, but sometimes the process can feel overwhelming or unsafe. That's where Vote Without Fear comes in. Whether you're voting for the first time or the 10th time, this platform has everything you need to feel confident and informed. From where to vote, how to vote safely, and what to expect at the polls, voting is your voice. And with Vote Without Fear, you can use it without hesitation. Visit votewithoutfear.com today and take the first step towards secure, empowered voting. Remember, it's your vote, and you deserve to vote without fear. That's votewithoutfear.com. Welcome back to A Fresh Story, the podcast where we have conversations about brave decisions to start over again. I'm Olivia.
And I'm Jenny, and we're so glad you're here today.
Hello, everyone. We are here with, I would say, both in real life and online friend of mine, Elizabeth. Elizabeth, I'm going to let you introduce yourself in a second, but I wanted to say this is the first episode in a series of an ongoing series, because that's how important it's going to be, about women's health and the state of women's health in America right now, because we don't talk about this enough. So, Elizabeth, we're really glad you're here today. Can you give us a very general outline of who you are?
Sure. So thank you so much for having me on today and giving me the space to share my story. It's not something that I've widely shared even amongst close friends. But I think that it delivers an important message, in the times we're living in now, in particular with women's health issues. So yeah, we met in Long Island. When we were both launching our businesses, and I lived there briefly. And I'm also a mother of 2 boys, and a bonus mom to a stepdaughter.
Love that.
Very exciting.
Love that.
Whole new world for me in the last 5 or 6 years. And yeah, that's who I am. I work full time. I have a full time job, and always just trying to find the balance, right?
Always. And I'm going to just add, you have a very cute husband. He is adorable.
I do. He is a great husband.
He is. He's adorable, and I just love to see your love story. Always inspires me. So,
thank you so much.
We are doing this episode because you actually approached me about sharing your story, which I really admire. I'm going to let you take the stage here. Tell us what happened.
Okay. So I'll try to be sort of brief with this story. It's sort of 2 stories connected into one, and it is probably going to be a little bit emotional for me. It may be emotional to some listeners as well, whether they did experience something similar or, they have a fear of experiencing something similar. So my story kind of starts right after I met my husband. I was actually going through a divorce, or had just gone through a divorce, and I had met my now husband. And we were together, and met, and we're enjoying our time together, and just sort of establishing a relationship when I became pregnant. It was something that was not planned, but was certainly, we weren't opposed to that in any way. We were just new, like any new couple, weren't really sure, if the relationship would last. And before we could even think about any sort of options, when we became pregnant, it became very, very clear that, and we were very lucky in this sense that we went to an appointment right after we found out we were pregnant, and an ultrasound was performed, and it did indicate that the pregnancy was ectopic. It was in my left tube. I knew nothing about ectopic pregnancies, and I had 2 very healthy live births with my boys. And, I was very, very scared, but everything happened so very fast in this situation that there was almost no time to really think about it. I was, sent to my gynecologist's office. I was given methotrexate, which is actually, I believe, a chemotherapy drug. It will stop cells from dividing. And that is what's known as a medication abortion. So using medication to terminate a pregnancy, that is what that is considered. I knew nothing of this when this happened. And I think at the time, I very much felt like, this isn't something I chose when I kind of learned more about it. And so I was more comfortable with it, but also still really scared and upset about it. So I sort of like put it in a box. I don't know if that makes sense. And just sort of like, I'm going to put
Mm.
this over here and not think about it because, it's not going to happen again anyway. So it's not a big deal. I'm not going to think about the fact that, this happened to me. So 2 years passed. We really didn't talk much about that experience. Again, it was just something I put away in the box. 2 years later, and right after that, I should say, I had an IUD placed. I was very hesitant to use anything hormonal because I had had some issues with hormones. So I had a Paragard placed, and I was great for 2 years until I wasn't. And I felt as though it was making some changes in my body or perhaps causing some changes in my body, and I was uncomfortable with it. So I decided to have it removed. And it was that time period where I decided to have it removed, and I had selected a different form of birth control where I got pregnant. The new form of birth control had not taken effect yet. So there was that small window, and my body just said, I'm taking this chance. So we became pregnant a second time. And this time, we had been together a little over 2 years, and we were very comfortable. And, even though having more children wasn't necessarily in our plan, it was not something that we were upset about. We were,
Yeah.
something that wasn't welcomed. So as scared as we were because of that first experience, which then is now sort of creeping up in my brain as I find out I'm pregnant, um, you know, that sort of coming back but the fear is sort of wearing off a little bit as I do my first beta test, and that comes out great and the numbers are increasing, and I think, okay, it's not going to be like last time. This is going to be different. So I found out I was pregnant on Father's Day 2020, and I was roughly about 5 weeks pregnant, maybe six. And I about I don't know how, it's 2.5 weeks, 3 weeks later, 4th of July, my husband and I are shopping, and I all of a sudden couldn't walk. I couldn't walk.
Mm.
I was in that sort of box that I had tucked that last experience away, which I didn't have the same symptom of feeling very, very sick. It sort of opened up, and then, everything's going through my head. What's going on? This is not normal. This is not like my first two pregnancies. This is not like my ectopic
Mm.
pregnancy. This is so very different. And I had not had an ultrasound at that point. The ultrasound was scheduled for the week after the 4th of July.
Mhm.
So I ended up being rushed to the hospital, where my doctor had called ahead, and they were to expect me there. I was put in a room, and from that point, I was told that I would see an ultrasound technician. So we went through that. And from that point on, everything is sort of a blur. I remember saying something to my husband after the ultrasound. I was in an incredible amount of pain, and just saying please to him. That's really all I remember
Mm.
saying. I just didn't really know what was going on.
Mm.
I was given pain medication, but I think I knew in my head that this is what was happening. This was an
Mm.
ectopic, and that it just wasn't caught as soon as the first one was. I
Yeah.
did also know going into this pregnancy that when I became pregnant, my OBGYN had advised that the likelihood of me having another ectopic after the first was very high. I did kind of know that, but again, I sort of tucked that away because I didn't really want to think about that. It was
Yeah.
a bad experience. I'm not going to think about that. This is going to be
Yeah.
different. And unfortunately, it wasn't. So I did undergo surgery. My lap tube was removed, as was the pregnancy that was developing in it. So a surgical abortion. I know that's not a term that OBGYNs use. It's an abortion procedure, but that's how I used to describe it instead of a
Mhm.
medication abortion, a surgical
Right.
abortion. So a little bit more invasive, obviously. I do remember waking up and just being so confused, and asking my husband what had happened. And he was in a lot of shock as well. So he
Yeah.
wasn't really certain. Like, he's like, well, the doctor came in and spoke to me, and, you can go to the bathroom and we can go home. And I was like, what happened? Like, what was done to me during
Mhm.
surgery? And
Right.
it wasn't until 4 days later that I finally got a call back from the doctor. And please don't get me wrong, I'm very grateful for this doctor. This doctor, by and large, saved my life.
Mhm.
Um, but you know, and it was a holiday, so there were things going on, and it's okay that she took some time to call me back. I'm at peace with that. It's all right. Um, but that level of care, I think that I really for a while put that into question. If this is the kind of care that I'm receiving, again, not, my life was saved. But if this is what I'm receiving in New York State, what about what are women experiencing in states where abortion is fully banned and this is considered an abortion procedure? So I sort of have for a very long time questioned what that's like for other women. And again, going into this situation the second time, which was obviously for me, it was much more traumatic than the first time. Um, I really did have a little bit more of an opportunity to reflect on what happened after I spoke to the doctor who did provide some answers. And then since then, it's taken me a really long time to truly understand what happened with that pregnancy, both, during the pregnancy, how that could have happened, and then, during the operation, and then, the grief and the loss and the trauma that I felt afterwards. And it actually hasn't been since the last, I'd say, 2 years that I've really thought in depth about it. I've thought about those other women in other places, in other states who cannot receive the care that they need because doctors' hands are tied often with loss. I think about how alone I felt and how scared I was and how sad I was about what had happened. Again, something that happened to me and having a procedure that I otherwise would not have chosen to have. And I think about that a lot. And I think about that in the context of healthcare and the direction that I would like to see this country go in a more positive direction and a more focused on women's health, because there's that like before, during procedure and then the after part that no one talks about. No one said to me, do you need to go talk to a therapist? Is there a support, maybe go talk to a support group or get involved in a support group. And I think by and large, when I did actually try to research that on my own, there was just nothing there. There were some online forums, but nothing like where I could listen to a podcast and talk and hear someone speak about their experience and not feel so alone. And I think that that's really what I was hoping to get out of this conversation is just share my story and let people know it's okay to feel the way you feel and you are not alone. And there are many others who've experienced something similar, and it's all right to be sad about it. It's all right to feel grief over that and to feel confused about it also, because there's just so little information out there. And that's, again, another question on women's health. Why is there so little information about this kind of condition? Um, can we be doing more studies? Can we be reaching out to those women who've experienced this and bringing them together and finding commonalities? And I mean, I'm talking more of a social study rather than a scientific one, but perhaps that is a great way to move forward. So that's
I appreciate you sharing all of that. And I have so many thoughts. I'm going to try to think about what I want to attack first here.
Sure.
I almost want to go backwards. I think, when you're talking about lying in the hospital bed, first of all, you had a procedure done and then they tell you to just go to the bathroom. As soon as you can go to the bathroom, you can go home, right? The state of which we view women in this country, that they are just things in beds, right?
Yeah.
And that you didn't have anybody literally explain to you what was done to your own body. How did that affect your relationship with your body after that?
That's a good question. I very much struggled with that. And to this day, I think to a degree, I struggle with that. Part of it is because I still don't have the answers as to why it happened, and that may never happen. Or why the ectopic happened to begin with. Why is that? Why do they keep happening to me? But yeah, I mean, I guess it made me feel just confused. Like there was just utter confusion about what was happening in and with my body. Was it something I did, that could have caused this? There were just no answers, right?
Right.
Especially right after the procedure. And just so many questions I had. And again, just no real answers, but it did make me feel like I was not really a person,
Yeah.
like I'm just a body in a bed, right? And you could just go home, even though you just experienced this traumatic, you
Mm-hmm.
know, experience. And where is the aftercare for women in these situations? I mean, we all know, at least in my experience, the aftercare after you have a child, a live birth, is not
Mm-hmm.
really up to snuff in this
No,
country,
no,
in my
no,
opinion.
no.
And maybe others have experienced something different, and I'm so glad that they have.
Mm-hmm.
But it's certainly not what I experienced after live
No.
births. So, I think that we're really missing the mark in many ways in women's healthcare in that regard, both
Yeah.
for live births, situations like this,
Yep.
stillborn births.
Yep.
What kind of care is provided? Is there staff in these hospitals that are really trained to
Yeah.
provide that care? Because if they're not trained, it's not their fault necessarily. Most people that I've dealt with in the healthcare field are very compassionate people, but you know, this is really specialized care for very
Yeah.
specialized, unique situations. And I just think the state of women's health care in that regard in this country is really just it's not up to snuff. It could be better,
Well,
and I think we could be doing much
could be a
better.
lot better. And I think it's so dehumanizing, right? To say
Yep.
not only do they physically alter your body forever, but we're not going to tell you exactly what happened to you. So you're going
Right.
to be gaslit to thinking that actually it wasn't a big deal. You can just go to the bathroom and go home, babe. And it's like, well,
Yep.
actually, you just changed my entire existence.
Oh.
And right, and now I'm supposed to just like recover. I'm curious, what was your husband like during all of this?
My husband is a very complex man, and I am actually very, very grateful for his complexity. He likes to pass himself off as just a simple, regular guy. But he is much more emotional than that and much more passionate than he will come across as. And I know that, try not to cry. He was upset. He was upset for the loss of something that could have been, obviously, but also I think he was very upset with the care that I received and seeing me so hurt. I remember saying please to him in that OR room or ER room and just looking at his face, and he was just
Yeah.
so confused. I remember seeing his face when they wheeled me out of the ultrasound room and I was screaming, and um you know he he comes from a family of healthcare professionals, and so I think it was eye-opening to him because his family, they're wonderful people and they truly do care about patients, and they always put patients before
Mm.
profits. I know that's a thing in this country. It's real, like a lot of other things in capitalistic
Mhm.
societies, but
Capitalism, yep.
right. But I think that was eye-opening for him. I think it was very upsetting, even if he did not verbally express it as often as someone else might. I think that it was incredibly scary for him. Family is everything to my husband.
Yeah.
We have built this little blended family together, and he is so proud of it and so happy. And it is everything to him. So to see
Yeah.
his person go through that and dehumanized in many ways, and to not have the answers for me and to not be able to help me was, I think, incredibly painful for him.
Yeah.
And when we talk about the things that happened to my body that I did not know about, going back to that call that I finally did receive from the attending surgeon, she said, "Well, I removed your tube." She asked, "What would you want to know? What would you like to know about the surgery?" And I said, "Well,
Everything.
what happened?"
Right.
Everything, yeah, because
Right.
I don't know. And again, I cannot say it enough. I am so grateful to her.
Yes, but
But I just had a lot of
you
questions.
can be
Right.
grateful. You can be
Right.
grateful, Elizabeth, and expect
Yep.
answers about what happened to you.
Correct. Yeah. Right. And I think just because I was so confused and scared, I just couldn't really verbalize that either.
Yeah.
But she said, "Well, I removed your tube and the pregnancy in the tube, and but I saved your ovary."
Thanks.
And you know, I didn't even know. Again, so confused and to a degree very ignorant about my own body in this regard. I didn't even know that like the ovary and the tube were not actually connected. Right. And
Mm.
so I'm like, maybe you saved the ovary, but you got rid of the tubes. So like, what's happening? What's happening in there right now?
Is
And
it
it's just,
floating?
again,
Right.
right. Is it just floating there in space? Like
Right.
what's going on? And I'm not a medical professional. So, I can only just do the research I can learn and discover. But there was a lot of questions there. And I think that she did expect me to some degree to know that about my body. And you know what? That's okay. If that was her expectation,
Well,
I
yeah.
did. I know now.
But I
But
think that goes back to a much bigger conversation, right? About women's bodies and
yeah.
what we are told and taught. And maybe we were taught once in the eighth grade and we don't refresh that again. Right. Yeah.
Right.
I mean, I would think that you would want to know everything about what happened to you because
Oh,
you're a young mom. You have a long
yeah.
life not ahead of you. You want to know what your medical history
Right.
is.
Yeah.
And the fact that I think I'm curious too from your husband's perspective, and I just this dawned on me as you're talking. I wonder if some men, when they see their wives or their partners go through this, are shocked at the care that women get in America right now.
That is a great question. And I mean, I wish he was here to answer. He's at work right now, but it is something that I would like to ask him, and maybe I can follow up with you and just give you a written
Yeah, I'm
answer
curious.
later, and we can kind of add that in. But I think that he was shocked. I think he
Yeah,
was shocked. The whole situation though was shocking, right? So, you know, there's the shock of what's actually happening and the shock of this sort of aftercare and dehumanizing, you know, situation. But I do think that there was an element of shock in what was going on with the
yeah.
care, the level of care for his person. At the time we were just engaged, we weren't married, but I definitely think there was an element to that. But I'm going to ask him because I'm kind of curious as well to see what he.
Yeah. I am. And also, I mean, we keep talking about this level of care, which you got that care because you live in New York State, right?
That's correct.
And you got that level of medical care, which
Hmm.
is wonderful. But the
Yeah.
bigger conversation here is that there's also so much other care, right? There's the spiritual, the emotional,
Right.
the aftercare, like you're talking about. And so you survived, which we're all so
Yeah.
happy about, right? But you're living with this as
Hmm.
this huge trauma.
Yeah.
And I'm going to ask you, Elizabeth, if you had lived in another state, would you have died?
I believe I would have. I believe
Yeah.
I would have.
Yeah.
And let's keep this in mind too, because it is something I do think about so often. Because I like to consider myself a compassionate person. I am a white woman living in New York State, a married white woman living in New York State
Yep.
with a bachelor's degree and a master's degree, and a family and support and a full-time job with excellent healthcare. Um, if you dropped any of those things off or swapped them out for different situations, right, and dropped me in another state, I most certainly would not. This would be an entirely different circumstance. And I think about those women. So not just the women who are very much like me, right? But women who aren't like me, right? And who are struggling financially or don't have a partner or don't have family support or health insurance and who live in a state where this procedure could be construed as illegal and not an exception to an abortion ban. And I think about that, I think, just as much as I think about how the conversation is not happening.
Yeah.
Right. And there are all these women that really could use some support in situations like this. Obviously,
Yeah.
women can use support in all different types of situations related to pregnancy and family and health. But this particular conversation, it really is not happening. And
Well,
so, and it's
right.
certainly not happening again in groups and other groups of individuals that don't look like me and don't have the same experiences.
No, it's not. Yeah.
That is heartbreaking to me. It is heartbreaking because we, at the end of the day, are all just human beings.
Yep.
We deserve the care so that we can live and achieve the things we want in our lives.
And I think it's so nuanced too, right? Because you're looking at the political spectrum, and to bring abortion onto the table for a second here, abortion is so many people think it's just one thing, right? It's an abortion. What you're talking about, and I've had friends also have pregnancies like this, or chemical pregnancies, or miscarriages that they bled out for days, right? What we're talking about are pregnancies that were very much wanted and beyond your control. You could not control where that egg developed, that embryo was going to be developing in your body. Right. And so to punish women, right, to literally let them die for something that was out of their control is really cruel, right? And inhumane. It's inhumane.
Yeah, it is.
And we're not talking about, I believe all women should have the right to choose, right, their own healthcare. And but this is something that is not in your control. And so what was there? I'm curious for you. And was there feelings of guilt and shame that came up during this?
Absolutely. I mean, my background is a very interesting one, but I was raised Catholic. I was raised to believe that, life is sacred and that, abortion was a bad thing. And I think that we as a society have gotten so far away from intellectually defining, right, this entire issue, right? Yeah. So we have now lawmakers defining, right, medical procedures, right, that are life or death for many women, and whether that life or death is, having an ectopic pregnancy, or if they have this baby, their whole life is going to be destroyed.
And let's be honest, and it's not
happens.
Yes, and it's also mammograms and pap smears and breast, all of it's women's health care encompasses all of us, right? So, it's a much bigger issue, 100%. And often, like,
it's huge.
These lawmakers don't have any idea what's happening in women's bodies anyway.
Right. So, my thoughts on that are that, it's now as an adult and having, experienced two abortions, a medication abortion and then a surgical abortion, which is something that I would have never chosen for myself. And I would have never said, if you had asked me, when I was younger and married to my first husband, would you ever have an abortion? Of course not. I would never have an abortion. That's not for me. It's frankly, I don't care what other people do with their bodies. That's their choice. But for me, that was not an option.
That's feminism. Right. That's feminism.
It's never going to be an option. But then here we are, 6 years after my first ectopic pregnancy and abortion, and then 4 years after my second ectopic pregnancy and abortion. Yeah. And again, it's just not something that I would have even thought of. And that's really because of how it is defined, and the fact that we do have these lawmakers who are now making medical decisions. I mean, I recently heard something, and it could have been a meme. It could have, so just full disclosure, right? Didn't do a study, but I heard some clip, right? And I really I'm not a huge fan of clips because the analyst in me just hates them, right? But I heard this clip, and it was like lawmakers, trying to like explain what a uterus is. And just, I mean, it's just so mind-boggling to me that these individuals, right, that have elected to legislate, right, are legislating like our bodies, but they don't even know. I didn't even know what was going on with my body, and this person thinks that they have a right to create laws about my body or someone else's body, and and they don't even know like what a uterus does. Or they use the term womb, which is not a medical term, right? So that's I think a biblical term, I believe. So it's just, I am very sort of passionate about this issue, but again, more so because I do believe that there is just so much confusion, right? And how do we begin having conversations about it so there isn't so much confusion, so that people don't have this happen to them and just be so confused and so lost and so scared and feeling uncomfortable in their own bodies and being in a constant sort of state of grief and trauma. And some of that goes back to aftercare, and some of it goes back to the care you could have received when it's happening. And then conversations just like that.
So if a woman is listening to this, Elizabeth, and she has gone through this, what would be something you could say to her?
I would say that you are not alone in this. There are many women who've experienced something similar or exactly what you have in some cases. And that there are people out there that are willing to listen and hear you. I would highly recommend therapy, but if that's not your thing, that's fine. Just tell someone, talk to someone about it. Anybody, write about it if you have to. If you don't feel comfortable, talking to somebody. I think that oftentimes as women, and I say this because I've experienced this myself as a woman. I think that oftentimes we feel like when we're going to take something on, we have to champion it, right? We have to take it on and carry it everywhere, and it has to be, our thing. And I think that I'd like to tell other women, not just with regard to this, but with regard to other things, we don't have to champion everything, right? We can pick and choose, right? But if it's something that you feel strongly about, don't hesitate to stand up and speak about it. Again, you don't have to be the poster child. You can just be someone with a story, right? That still makes a difference. That makes a huge difference. It could just be one person. One person could listen to this and be like, I understand what she went through and I feel better about it now, or I understand more and I don't feel like I'm alone. And that's it. My job is done. I did what I had hoped to do in this regard with this podcast. But it's okay. You get to pick in this life how much you want to take on and how little you want to take on. Or if you just want to stay silent, that's okay too. If you don't want to, but I would encourage other women to speak to someone, anybody, and talk about it. And if you don't want to talk to someone you know about it, you can email me.
I love that.
That's okay.
I love that. Yes, I love that. Well, thank you for sharing this. I think it is so important to have these stories in the world so that if at least only one woman, right, can listen to this and know that somebody else went through it. But I know this was a big turning point for you in sharing your story. And I just appreciate you and all of the work that you do to make this world a safer place for all women. So thank you.
Thank you. You as well.
Thank you for listening to today's episode. A Fresh Story podcast is produced by Fresh Starts Registry, the first and only platform for everything you need to begin again, from home items to Hype Team and everything in between. You can learn more and read today's show notes at afreshstory.com. Are you ready to use your vote? Whether it's your first time or you've done it before, Vote Without Fear is here to help you feel prepared and safe every step of the way. From understanding how to vote securely to knowing where your nearest polling location is, this platform has all of the information you need. Don't let uncertainty hold you back. Your voice matters. Head to votewithoutfear.com and make sure that you're ready to vote with confidence and peace of mind. Remember, it's your vote and you deserve to vote without fear. That's votewithoutfear.com.